What are the pros and cons of liposuction for cellulite? Liposuction is the process of surgically removing fat from one's body using a suction pump. Thanks to the wonders of medicine, cosmetic surgery in particular, those who are not happy with their excess body weight can now have it vacuumed out. Liposuction is not meant to take the place of diet and exercise. It's geared towards those individuals who are close to their desired body weight but whose body fat is localized to one area. Areas most often undergoing liposuction are the belly, hips, buttocks and thighs. While liposuction does give one a slimmer figure, if one wants to keep off the weight afterwards, one will need to follow a diet plan. The weight can and will return if not maintained. It might not be as prominent as it originally was, but if weight gain tends to be an issue, you'll want to take the proper steps to maintain your figure. Contrary to popular myth, any additional fat accumulation will not redistribute itself to other parts of the body. Performed by a licensed, experienced professional, liposuction is a safe procedure. If a small area is to be liposuctioned, the procedure might take only an hour or two. In many cases, the patient can go home afterwards with her surgeon's okay. If a large area or areas are to be treated, the surgeon will most likely recommend an overnight stay at the hospital where the procedure is being performed. Anesthesia is used during liposuction so the patient can expect to be quite groggy upon awakening. For this reason it's always a good idea for the patient to have a ride home after the procedure, especially if it was performed on an outpatient basis. Any pain or swelling after liposuction is minimal, though one should expect some discomfort. It's always best to take it easy after the surgery. No heavy lifting or strenuous exercise should take place without permission from the patient's surgeon. Liposuction patients are usually required to wear a compression garment similar to a girdle for a couple of weeks after surgery to help provide support and comfort from any swelling. Liposuction does leave permanent scarring. Since incisions are made, and subsequently sutured, one can expect permanent reminders of this surgery. The operating surgeon may prescribe antibiotics to prevent infection, one of the risks of liposuction which may be quite severe. It's important to follow all post-operative instructions and notify one's surgeon immediately if infection is suspected. Infection isn't the only risk to liposuction. One can also experience burning from the ultrasound probing device or even organ damage. If one is considering liposuction, one is advised to research all of the risks involved. In addition, it is a good idea to research the surgeon and operating facilities. Always ask for references. Some of the pros of liposuction for cellulite include the possibility of an improved body shape and body image. People who have liposuction are also often able to report seeing results within a few weeks after the procedure. Cons of liposuction for cellulite include extensive swelling and bruising. Liposuction also frequently causes scarring, but these scars are usually minor and tend to fade with time. There is also a slight risk of serious health problems occurring as a result of the procedure, such as blood clotting and fluid buildup inside the body. A person who is considering liposuction for cellulite will need to weigh the pros and cons to determine whether the procedure is for her. One of the best ways to do this would likely be to speak with a doctor who performs liposuction. After a medical history is taken and the amount of cellulite and body fat a person has is determined, a doctor should be able to give a person an idea of whether she should opt for the procedure. It may also be a good idea for a person to speak with not only a doctor who performs liposuction, but also a doctor who doesn't. This is because there could be some doctors who will tell their patients that they should receive liposuction for cellulite even when it may not be the best option because they want the business, but it is probably safe to assume that the majority of doctors are honest with their patients. Another thing a person should consider before deciding on liposuction for cellulite is whether she has exhausted all other cellulite removal methods. Some people opt for laser cellulite removal rather than traditional liposuction because laser procedures are typically less invasive and recovery time is generally shorter. Many people also claim that the results they achieve through laser cellulite removal are consistent with what most people get through traditional liposuction. This may be a good option for people who are undecided about liposuction for cellulite to explore. In the event that a person decides to go through with liposuction for cellulite, she should be very realistic about her expectations. Liposuction, both traditional and done with lasers, is not guaranteed to work. Many people still have cellulite even after going through liposuction, although in many cases the appearance of cellulite is much improved. It is also important for people who are considering liposuction for cellulite to keep in mind that the cellulite will likely reappear if weight is gained.